We are thrilled to have Dr. Aida Owlia with us today, a Canadian trained physician with a passion for emergency medicine, critical care, and cosmetic injectables. Dr. Owlia is dedicated to achieving natural results and prioritizing safety in her practice. With a strong emphasis on high quality education, leadership, and physician wellness, she brings a unique blend of scientific rigor and artistic vision to her work. Let's dive into her journey and get some very useful insights she has to offer to all of us. Dr. Owlia, welcome.
Thank you so much for having me. What a lovely introduction. Thank you.
Thank you very much. First of all, let's start with your journey, then we'll go to the scientific journey. So, can you share your journey into medicine and exactly what inspired you to specialize in emergency medicine and critical care, please?
Absolutely. For me, it was a very personal decision. It was driven in a deep emotion of feeling helpless and hopeless in the facing an emergency of a family member of myself long time ago. And I just remember feeling like I couldn't do anything and I had all the desire to help and to do something. And I vowed to myself that I would never feel that way again, nor would I ever want to witness another human being go through that. And for me, it was always a vessel to be able to be effective when every second and every minute matters in facing an emergency. And that's why I dedicated my life to educating myself in that profession. And I was lucky enough to be able to complete my degree. And happily, I've been working as an emergency physician for about 6 years now.
Wow. That is truly saying that truth is always truth, but with experience, it becomes your reality.
Absolutely.
Absolutely.
Yes. And I
Yeah.
find, this kind of a job is a very stressful
Yeah.
profession. And I find that you have to be driven by something very strong within you
Yeah.
to guide you through that journey and to give you resilience. And for me, it's a very personal desire from a very personal experience.
That's an excellent word that you used, resilience. That's a very, very powerful one. We also believe in that. So, how do you, as you said, that it is a very stressful occupation. So, how do you balance the high stress environment of emergency medicine and your passion with cosmetics injectables? How do you balance between the two?
I find that the two worlds are quite complementary, to be honest with you. One is
Oh,
extremely
wow.
fast-paced
Yeah.
decisions, you're making life and death decisions in a matter of seconds. You have to synthesize very complex information in a very quick amount of time. Oftentimes, you don't even have adequate time or the adequate information to make, contemplated decisions, but you have to do very fast analysis of information and act fast and think fast. Those are the premises of emergency physician as an emergency physician in the emergency department. I'm working on like one coffee, which is very abnormal for me, so bear with me.
That's
In
okay.
terms of cosmetic medicine, it's a more paced environment. You can pace yourself. You can dedicate a significant amount of time in your consultation period to get to know your patient quite well, to explore their desires, to explore their goals, to go through all the modalities which can help them address their goals and to make an individualized plan.
Mm.
It also fosters an environment of long-term relationship with your clientele. You see them when they're 30, you see them when they're 50, you see them when they're 70. You
Yeah.
watch them, through stages of life. You hear about their personal life, if they have a vacation or they have a wedding coming up, which normally you wouldn't have that luxury in the emergency department, as you oftentimes have to act fast because safety doesn't allow for that kind of a relationship, and you don't necessarily have a longitudinal relationship with the
Yeah.
patients. So I
True.
find that they balance each other out, and I think each of them adds to your longevity in the other, because they each have their unique demands, and it's going to be a balanced profession together.
Yeah. That's fascinating because, yeah, the way you represented it, now I get also the answer that yes, these are actually complementary. But otherwise, for a non-expert or layman like us, we are thinking, oh, these two are completely different world. So what are some of the most rewarding aspect of your work in emergency medicine, though it is very stressful, and how do you compare to your experiences of that area to your cosmetic procedures?
Absolutely. So, I mean, they're both very procedure heavy and outcome oriented, if you think about it.
Yeah,
So you
yeah,
work quite a lot with your hands in both professions.
yeah,
So as you said, they may to the eye of somebody who's looking at the surface feel like, the opposite sides of the spectrum. However, on a closer inspection, you will see that there's a lot of not only similarities, but also complementary aspects to both. So,
yeah,
in terms of the emergency department, one of the most rewarding things is that you see the outcomes of every decision that you're making. So, if
yes,
somebody's blood pressure is low, by giving a medication, doing a procedure, finding out why that reason is, and having an exploratory um, approach to the reason why we are in a situation that we are that has caused hemodynamic instability, you fix it. And that satisfaction of you fixing something, you helping somebody, you see an immediate gratification on the monitor, in the patient's eyes, and in the eyes of those loved ones at the bedside.
yeah,
And that is the most incredible, rewarding aspect of being an emergency physician. And oftentimes, this opportunity is provided to you in a very, very critical day when people are having the worst days of their lives. I always say, as an emergency physician, 90% of my day is that 1% of life nobody wants to think about. So to
mm,
have the
yeah,
empowerment and the privilege to be part of that journey and to make an
yeah,
impact is
true,
what empowers me and what brings me to work with satisfaction every day. And also working in that kind of an environment, you have a certain appreciation for life and a certain respect for safety, which makes you a safer injector, which makes you
yeah.
somebody that wants to approach, cosmetic medicine and aesthetic procedures with a higher degree of safety. So I feel like together they balance each other out quite well, and they complement each other that way.
Yes, and you did it nicely because my next question was on safety, so you have already covered that. It was that, yeah, how safety is related to both of the worlds and how safety and other things are concerned. So you have answered that. So, and one of the thing is it's a very fast-paced job, and you always encounter novel new
Absolutely.
situations and everything. So how do you stay updated with the latest advancements in both the sectors that you work at? That means emergency medicine and cosmetic injectables. How do you stay updated? What is your
Excellent
policies?
question.
Yeah.
Excellent question. And I think there's a significant amount of dedication that is required in order to make sure that you are keeping yourself updated on the advances in two seemingly separate fields. Quite different in that regard, absolutely.
Yeah.
I find that for me, I kind of use a multimodal approach. I do my own independent
Oh,
reading, after shifts or before shifts. I do have dedicated time to read articles, or I partake in courses or seminars that I find helpful that would address the gaps that I have identified that I would like to address. And part of being a physician that works in an environment that cannot be easily predicted, and that whatever you've learned in school is always going to be challenged with the nuances of reality, is
mm,
that it really keeps your creative mind going at all times. You have to get creative. You have to find different ways of finding information,
yeah.
or approaching a problem that, the classic ways are not quite working for it. And I find that that creativity also exists very much in the aesthetic world. And it's honestly where art and medicine marry each other. And for me, that was really one of the main drives for me to kind of foster my love of medicine and cater to my creative side under the same roof in the same profession, and just kind of help people feel confident. But I would say hands-on training, simulation sessions, reading yourself, because there's a lot of good work that is being done in both fields by very, very, very amazing researchers and clinicians out there. So being open to learning from others, collaborating with other consultants. There's always something to be learned from another discipline that you may not even think that is, at first glance necessarily a relevant area. So for example, in cosmetic world, we now have calcium hydroxyl fillers. There are calcium-based fillers. Interestingly, one of the things that is worth considering is perhaps looking into the urology literature.
Oh,
How do we treat kidney stones that are made of cancer? How do we treat complications of calcium-based fillers when we
oh,
look at how our urology colleagues are managing their calcium stones, right? So
oh.
it's a bit of an interesting world where I think there's going to be a lot of amazing advances, and as a collaboration of different professions that kind of bring together nuances and new discoveries, which I think makes this a very interesting time to be in this field.
Oh, fantastic. So you are, so you work in a very stressful environment and other physicians like you. And after that, after doing your overall occupational duties and responsibilities, then you become a lifelong student and you are continuously updating yourself. So, what is the importance of physicians' own wellness in that? Like, what strategies do you use to maintain your well-being, and how do you support your colleagues, your teammates in this regard?
Honestly, I think team is the operative word here. You have a team to count on, and forevermore, I encourage everybody, whether or not they are a resident physician, medical students, nurses, whoever works in highly acute areas, and even frontline workers, that we see things that a lot of people don't see. It's almost like kind of in a way being on the first line of defense of health care, and it is important to always make sure that you have insight into your own wellness, because I highly think that it correlates to the level of care and the quality of care that you can provide. I fly a lot for work, so I always keep this in mind, and this is something that was said to us in medical school, that in the event of an emergency where the cabin pressure changes in an airplane, you have to put your own mask on before you help anybody else. Our instinct is always like, let me help my child, let me put the mask on. But if you are not looking after yourself, you're also going to be losing consciousness, and you're not going to be not only good to anyone, you're going to lose your ability to help, but you also have to become somebody that other people need to help out. So making sure that you are taking care of your own wellness is going to ensure that you provide good quality care and you maintain the capability to do so. So you always have to find something that brings you joy, and to give you resilience and longevity in this line of work, because otherwise you're going to get burnt out. And the concept of physician and healthcare worker burnout is one that is, fortunately, there's a lot of light being shed on it. And part
Yeah,
of us having the language to do so, to
yeah,
talk about it, to put a light on it, is going to help people kind of seek help when they feel that a burnout is coming, to
yeah.
reach out to colleagues that would understand,
That
to
aspect, yeah.
yeah, absolutely, what you're going through, to make sure that you have things outside of that world that brings you resilience, whether or not it's like a different a different kind of a career that is a little bit less acute, that you divide your time in, whether it's spending time with family and friends, taking a vacation, doing some artwork, singing, painting, um, reading a book, going for a walk, for everybody, it's different. But to have a repertoire that you can tap into and to maintain your resilience and your own wellness and to have insight into where you stand every day and to help yourself and to seek help when you're not able to help yourself anymore, I think that's the key.
Mm. And whenever you say that the weather, the atmosphere changes, or the cabin pressure, so I used to travel a lot, and now also I travel a lot, but mostly with my business purposes and everything. So one time, one of the cabin crew informed me that whenever any person, any doctors, whenever they're onboarding, if they tell us or if we get to know that there is a doctor in the flight, we feel a lot safer.
Oh,
We feel a lot safer. And if someone voluntarily informs us that, okay, I'm a doctor, I'm a physician from that country, and also if you ever need anything, because so many things can happen. So they spot it, and they say that we really know that there is someone there to help us. So my point of view was that yes, that is why we should take care of our doctors better, because if doctors are well, then they can save 100 lives.
I agree. I think it's I'm really glad that in this day and age and in this climate we are
Yes.
talking about it and we have resources to help and that we are acknowledging that it is a demanding profession.
Yeah.
And to speak to your point, I've been on two flights in the past year that they called out for a physician.
Yeah.
And the relief in the eyes of the
Oh no, please.
stewardess
Yeah.
when yeah, when she found out that I was an emergency physician, so the other healthcare professionals that they called out for, like anybody with
Yeah.
healthcare, was a pediatric physician, and that was an adult patient, and then another one was a pediatric nurse, and again an adult patient was having an emergency. So you're right, like the relief that you see in the
Oh,
eyes of
yeah.
everybody.
Yes.
So this is why I love my job, whether or
Yes.
not you're on an airplane or anywhere. It's just the ability to be that person,
Yeah.
stand up and say, you know what, I do know what to do. It's a very,
Yes.
very, it's the very reason why I do what I do, and every range, right? So like
Yes.
from birth to 90, seven, I'm your girl. I like that.
Yes. That is the thing. You can help any age people, any with almost because emergency after a certain period of time, you have seen things that maybe other people have never seen.
Yes, no, for
So
sure.
so that is why I said novel situations every time. So whenever you are dealing with a very broad range of age cohort patients and everything, and you have seen various types of like physical and sometimes even mental
Mhm.
breakdowns and illness and heart people and everything. So how do you approach, or how do you see that patient education, especially when it comes to cosmetic procedures and setting, should I say, realistic exploration or expectations? How do you see
Absolutely.
that? Please.
I think honestly, patient education is all about transparency, to
Oh.
go through the risks and the benefits and have the honest discussion that may be a difficult one to have, right? So
Mm.
when it comes to cosmetic procedures, a lot of people might take things quite lightly, but we know that with fillers we can have consequences of tissue death if it's not done well, or it's not diagnosed
Oh.
adequately. Yes. If we do um, not recognize that there is, the blood flow is not going to the tissue, then time is tissue. For every second that you're wasting, you're losing the tissue and the health of the tissue, right? And this is why it's so
Mm.
important that aesthetics medicine is provided by physicians and other healthcare professionals that can identify when things are not going well and what to do about it, right? So, but
Mm.
I find that I would say significant portion of providers don't have these kinds of conversations, and therefore your consent is not really informed, right? So
Mm,
you have to have these difficult conversations, and I go through them very openly with my patients. And yet, that honesty empowers them that, oh, I've been getting fillers for a long time. Nobody's ever told me this, right? So that
mm,
in itself prepares them in the event of an emergency. We have a protocol. This is how we're going to address it, right? If we have something that goes wrong, we're not going to be wasting time explaining kind of, we know that this is a known side effect of these products, right? And then
yeah, yeah,
no procedure in medicine is ever without risk. You take the over-counter medications, and you can have side effects, right?
mm,
So it's very important to be educated on it. And I think education equals empowerment. You can make decisions that are informed, be part of your own treatment plan. This is what I would and what I would not accept as a risk, right? And similarly, in the emergency department, same principles. It is important that even unless it's an emergency and the person is not able to consent, and then you act in their best interest as an emergency physician, which is a decision that I have to make every single day for a lot of people in the cosmetic world. You have the privileges of, like, let's have a sit down and talk about the risks and the benefits in detail, answer your questions, let me talk to you about what these treatments can do, and let me make
mm,
sure that this is actually aligned with your goals, because
mm,
a lot of people come and ask for something that is, they think, is going to give them what they're looking for, but it's completely not a thing, for example, that Botox can achieve, and you need fillers for that, and vice versa. Right. So to educate people, I think they're going to be having a language that is more effectively communicating with their provider. They can make better decisions, and they can stay involved and active in their own healthcare plan, and to watch out for signs of complications and to seek out help. Right. If you don't know what you're looking for, even if your emergency doesn't happen in the chair and in the office, you have
mm.
an empowered patient that can reach out to you, and you can resolve an issue that you, in absence of patient education, you could not have that luxury.
The way you explained it, that sometimes you have to have those difficult conversation, you have to have those difficult conversation as honestly as possible, maybe a gradual build up of that conversation. So it all kinds of touch with the leadership. So what role does leadership, even heading a team, heading an operation, heading a surgery, or helping in a surgery, in whatever capacity, leadership plays a role in your career. So how do you cultivate leadership skills among your peers and among your colleagues and for you
Mhm.
as well? How do you do that?
I think leadership is key to sustainability and to have an impactful healthcare delivery,
Mm,
particularly in the emergency medicine. Um, we work as part of a team, and the emergency physician is oftentimes the lead in managing traumas and codes, which are, multiple decisions have to be made simultaneously,
mm,
tasks have to be delegated, and to be done in a timely manner. I think leadership on a bedside level is prominent in running very highly acute cases, because one person, if one of the teachers that I had in emergency medicine always said that if you are trying to do everything yourself when the patient is very ill, and you are not an effective leader of your team, you are doing a disservice,
mm,
because you cannot physically do everything all at once. In life in general, everything is teamwork, right? We all
mm,
have to help each other. We all have to delegate to the best person that is capable to do something in a timely manner, despite the fact that we all want to have the sensation of maintaining control. Um, I think it just does a disservice if we're not good leaders in medicine, from a patient level to highest executive levels. If we're not identifying how to better deliver healthcare, and to do so more efficiently on a larger scale, to make healthcare more accessible for everybody, I think we're going to fail as a society. And I think this is why leadership matters, and leadership on a innovation level, which is a hallmark of the hospital that I work at, we really try to be innovative about making sure that the new healthcare that we are providing is fit with an aging population, with a growing population, with the demands that come with that. So it's important to stay vigilant, to stay curious, to keep reevaluating the needs of your population and to try to adjust, and also to incorporate all the new findings in literature and all the beautiful research that is going on into protocols and order sets in our electronic medical records to provide swift, evidence-based, and efficient healthcare. So I think it's a very broad topic, but I'm very passionate about it.
Yeah. Now, you have touched specifically the last line, evidence-based. That is one of the things that we follow. I have a background from HR. So in HR, we always tell that whatever you do with people, how do you want to manage people? Leadership is a big concept in that. So we say
Absolutely.
that evidence-based management, always. So in the previous question, you have talked about having difficult conversations honestly, in a candid way. And somehow I got the vibe that whenever you are talking specifically in the cosmetics injectables, you always try to have a very open conversation with the people that come to you for advice and for help.
Absolutely.
You try to make a nice balance between what they want and in reality what they need.
Yes, absolutely. And I
It's
think that's important. I
yeah,
respect people's times.
yeah.
I respect, these are not necessarily
Mm,
um, cheap procedures, right?
yeah,
So, and I encourage people to be mindful of cheap procedures because either, products are not Health Canada approved, either the
yeah,
provider doesn't have the knowledge. But with that, I think to have the transparency, to have these difficult conversations, and I tell my students, be brave enough to have these difficult conversations
yes,
because when
yeah,
you do, you will have the respect and the trust of your lifetime, you know, um, patients. They are going to come back to you. Even
yes,
saying no sometimes is may not feel good at that time, but people retrospectively will understand where you're coming
yes,
from because ultimately you're the healthcare
for sure.
provider, right?
Yeah,
So I
for
had a
sure.
patient, for example, that came in for a cosmetic procedure in the clinic. After a consultation, I identified what I thought was cancer on her skin. And I did say that absolutely, cosmetics should not be the focus. We should really go ahead and look into this a little bit further. So she was quite disappointed that she didn't get the cosmetic procedure that she came in for. But a month later, she came back and said it was cancer. They resected it, and thanks to you, I immediately sought out the care that you recommended. And you know what? She came back 4 months later with the deficit that was left after the cancer, and we helped with the cosmetic procedures to regain her confidence. And I think these are empowering stories that
Yes.
sometimes tough conversations are not easy and they don't always go as planned, but it is still important, ethical, and it's the right thing to do. So be brave and face those difficult conversations and make sure that your consent is as educated as possible because that's in the best interest of everybody. And ultimately, we're all here for patient safety above all, right?
That's a very powerful story because exactly that is the same thing. What they want and what they actually need. You just guided the person in a very, very right direction. And that is the main hallmark of a good physician that who cares for their patient and everything.
Mm-hmm.
Fantastic. Very powerful story.
Thank you.
Lastly, the medical field is very rapidly growing, evolving, enriching. What are your goals for your future of practice? Like how you want to practice in the upcoming times, and how do you plan to continue making a positive impact? You are already making very, very good positive impact.
Thank
How do
you.
you plan to continue that for your patient lives? Two things, two aspects. Yeah, please.
To be honest, the privilege is not lost on me. what I have currently is a really nice combination of all the fields that I'm passionate about, to work in emergency and in critical care, as well as in aesthetic medicine. I see myself continuing in all the three fields, but just more participation in leadership and education. I currently am an educator for multiple cities, and I really, really enjoy, and multiple universities. I really, really enjoy helping train the new generation of physicians and nurses, as well as injectors. I try to promote an ethical practice and resilience, because I think if we have ethical and well physicians, we are able to provide care that is sustainable and of high quality. And to continue to grow myself, because there's so much to know, so much to learn. And I would like to be doing the same things on a bigger scale, hopefully on an international scale, because education is really, really close to my heart, and continuing to be an academic individual in the fields that I'm very, very passionate about.
Those are fascinating lines. And to end the thing with that is that the whole conversation was very engaging,
Thank you.
relatable, and insightful. And dear readers, hopefully you get the guidelines, whatever Dr. Olia shared with us, that regarding patient education, regarding how we can evolve, and mostly the passion, the motivation she shared, we can get in align with that to build our own life and our own career in the same spirit. Thank you all for listening or reading to it. Thank you very much.
Thank you so much for having me.